If baby isn't in distress on the monitor, is the Pitocin still a concern for stress? If labor is slow, would you think that's valid to help progress when everything else is fine? Can Pitocin cause the body to stop making the hormones needed for birth because it starts relying on artificial ones? Do they automatically give Pitocin if you take an epidural? What if someone can't go into labor on their own? Can Pitocin cause that the placenta should have a hard time coming out? Is it important if the water has already broken and there are no contractions? Why can't they give Pitocin at a VBAC?
Giving birth is one of the most significant events of your life. Sadly, the joy that you should feel can often be replaced with anxiety and helplessness instead. As a labor and delivery nurse, I'm revealing insider information to educate you, reassure you, and decrease your fear. In this podcast, you'll hear empowering birth stories and experts weigh in on a range of topics. Being Jewish also has me exploring Judaism's influence on the reproductive experience. However, I speak to anyone wishing to navigate their journey with more joy and confidence. I'm your host, Chani Fingerer, and you're listening to the Happy Birthway Podcast.
Welcome to episode 61 of the Happy Birthway Podcast. Boy, am I glad that you are here and listening. So after I did my Pitocin and Labor episode, I put out a question box on Instagram and I got some really great questions with asking for information that I had not provided in my first episode about Pitocin in Labor, which is episode 59. So if you have not listened to it, then listen to that episode first. And now I will answer some more questions that some of you had that were great questions. And then I have another great episode planned that I'm not sure if I'm going to be able to get out this week. Again, I do feel like you deserve a second episode this week because to make up for last week. But I'm not sure if I'm going to be able to get it out, but it's kind of a juicy one. I'm really excited and passionate, and I just kind of really want to put it out, but I was going to be responsible, and I will first put out the part 2 for Pitocin in Labor. Okay, so here we go with the questions. If baby isn't in distress on the monitor, is the Pitocin still a concern for stress? So fetal distress is a very subjective thing. It's really not black and white. We're really good at figuring out when your baby is doing well. Like if your providers tell you that your baby is doing fantastic on the electronic fetal monitoring strip, then they're pretty sure about it. But there's lots of different characteristics of a fetal heart rate tracing that we look at, and the majority of fetal heart rate tracings are like indeterminate. We call it a category 2. It's kind of indeterminate. We're not 100% sure, and there are so many different characteristics. I will do an episode, hopefully one day, Yirtzeh Hashem B'li Neder, about, the different kinds of things that we look at. But overall, we are looking to see a pattern, and we're looking to see that your baby is overall tolerating labor. Almost no baby in the world. Very few babies have 0 dips throughout labor in their heart rate. But it's kind of looking at how frequent are those dips happening, what's happening in between those dips, etc., etc. So the goal is not to get your baby into a place of stress. It's looking at the strip and figuring out like when is enough. So we don't want your baby to be in a place where it's really stressed out. And that's part of your nurse, doctor, and midwife's job. They are looking to make sure that your baby is tolerating the contractions well enough, and that it's not coming up to a point where it might get really, really stressed. The next person asked, if labor is slow, would you think that's valid to help progress when everything else is fine? Well, you have to define what slow means. And ACOG's meaning of slow is that after you're 6 centimeters, so not pre-6 centimeters. Pre-6 centimeters, it's expected to take even longer, but after you're 6 centimeters dilated, it's either 4 hours of adequate contractions with no change, or 6 hours of inadequate contractions on Pitocin. And what adequate and inadequate means is for another episode, but basically with no change, those 6 hours of no change. So, if that's happening, then that's really something that you want to look into getting some Pitocin. But if your cervix is making some change over, a reasonable period of time, then there's really no right or wrong choice. Some would rather get it over with, and others would rather just let their body do its own thing. Again, as long as you understand the risks and benefits of having Pitocin. And in medical terms, this is called expectant versus active management of labor, where expectant is we kind of just watch and see, and active management is where we're doing interventions in order to try to do something, facilitate something in labor. But most of the time, honestly, your body's pretty good at doing it on its own. So that's a choice, and that's a conversation that you should have with your ongoing conversation you should have with your provider. Next question was, can Pitocin cause that the placenta should have a hard time coming out? So Pitocin in labor, I'm not sure if I mentioned this in episode 59, but Pitocin in labor increases your risk for postpartum hemorrhage. And the reason why that happens is because, I mean, there's could be other reasons, but this is the most common really way that it works, is where your Pitocin receptors in your uterus, your oxytocin receptors that are receptive to the oxytocin that, your brain usually makes, but if your brain is not making or getting artificially infused through an IV, if they get desensitized and they're kind of just like burned out, like I like to use the term burned out, if they're burned out, then your uterus is just going to kind of give out and get like pooped out and tired because it was flooded with too much of the Pitocin. Now, your body's usually good at making the right amount, but if for some reason your body, you need an induction or an augmentation or whatnot, and you're getting that artificial Pitocin infused, we are not as good as God is with figuring out exactly how much you need, and it can just put all of those Pitocin receptors into overdrive. And it can cause your uterus not to be really sensitive anymore to the Pitocin. Or because it just overcontracts too much during labor. And so, yes, Pitocin does increase risk for hemorrhage. And so there are many reasons why a placenta will not come out. But one of them can be because your uterus is kind of just pooped out and not contracting adequately. And that's why, friends, it is important for you to understand that nothing comes without risks. And IV Pitocin comes with risks that should be seriously weighed against the benefits of using IV Pitocin. The next question I got was, can Pitocin cause the body to stop making the hormones needed for birth because it starts relying on artificial ones? Well, you're getting Pitocin typically because your body's not making the oxytocin that is needed to put it into labor. And so you have to get it artificially. It's the artificial form of the hormone that your body's already not making. But like I just spoke about with Pitocin receptors, that's a whole nother story. You can be making a lot of oxytocin or receiving a lot of artificial oxytocin. Usually the oxytocin you're making, your uterine receptors are sensitive to because it's just like a natural body synergistic cycle. But if you're receiving the artificial oxytocin, Pitocin, if your uterine receptors are not sensitive to it, then it's not going to work. So that's more of the issue. And sometimes labor can kick in on its own in the middle of an induction. And, your body just like kind of figures out what to do and it remembers and, oh, okay. And sometimes it doesn't. So you can be 8 centimeters dilated. And if the Pitocin gets stopped for some reason, you can still remain that 8 centimeters, 4 hours later if you don't receive the Pitocin for some reason. So it can go so many different ways. Okay, the next question is one of my favorites, pet peeve favorites. Do they automatically give Pitocin if you take an epidural? Well, the more I speak to people, the more I have learned that yes, in some places, it's kind of like the default. Like they just hang the Pitocin alongside that epidural if your contractions are not every 2 to 3 minutes. That is inappropriate. You should be informed of this plan. It should be discussed with you. It should be a conversation. It shouldn't be something that's just like sneakily hung together with your epidural infusion. Now, those who get an epidural are more likely to need augmentation of labor, to need Pitocin, but not by any means is it a default. And I just want to remind you that the definition of labor is making cervical change. So even if your contractions are every 5 to 6 minutes, that's not in and of itself the reason to get Pitocin. It's not an automatic. Then a crazy thing happened. Someone messaged me telling me that they listened to episode 59 and they said that they actually always knew that they did not want Pitocin in labor, but mostly because they were scared of the added pain that it supposedly causes with contractions. And they said that they were entirely unaware that there are risks to the baby. And that's eye-opening for me to know, as, you know, from the nursing perspective, from the healthcare perspective of a healthcare provider, where like we take for granted that people will know things. No, there's risks to both mother and baby. And I'm glad that I was able to enlighten that person, and makes me think that many others were not aware of this as well. Someone asked if they can decline the Pitocin if they'd rather things progress on their own. So again, you can decline anything that you want. Nobody can force you into anything. There's no such thing as allowed or not allowed. But that being said, if it's being recommended, you want to ask about the risks and benefits for your particular situation. In some cases, it might sound to you like the risks are really not worth what, you know, the Pitocin is being touted to benefit-wise to give you. And in some cases, it really may be more beneficial for you to have some Pitocin. So it's nobody can force you to do anything. You can decline whatever you want, but you just want to really make an informed decision and understand why you are declining what you're declining. Before we continue, I wanted to let you know about a revolutionary diaper brand called Diaper, D-Y-P-E-R. These eco-friendly diapers are made with viscose from bamboo, so they're soft on your baby's skin while still being extra absorbent to handle your baby's biggest accidents. Diaper wants to pass on the savings directly to you by cutting out the middleman. They ship your diapers to you for a low, predictable price with no extras or gotchas. Set your subscription and let them deliver the exact quantity you need. If you need more, they'll deliver them promptly with their exclusive SOS service. If you need less, send them back with a prepaid label. You can precisely manage your deliveries using their website or their mobile app. One of the products that I think is really cool is their diaper sense. It's a small sensor that you attach to your baby's diaper, and it continuously monitors the temperature and humidity surrounding their skin. It will help you optimize your diaper changes, reduce overall diaper use, and may help reduce instances of skin rash due to prolonged exposure to moisture. All you do is snap it to the outside of the diaper and connect it to Diaper's app. It will notify you when number 1 or number 2 happens. Subscribe through the link in my show notes and you will get a free bonus diaper bag just for trying them out. You can cancel anytime with no obligation, but still keep the bag. If you have been struggling with nausea and vomiting from your pregnancy, Ematerm might be the answer for you. Ematerm is a safe and effective anti-nausea wristband that prevents and relieves nausea and vomiting induced by pregnancy or motion, such as car and boat rides. It releases a low-frequency pulse that travels through the body's nervous system to the part of the brain which controls the stomach. This interrupts the nausea signal pathways. Ematerm is FDA cleared and designed to put you in control when you need drug-free therapy with no worries about potential side effects. Users can choose from 5 levels of intensity to achieve the best effect. The unique wristband design holds the device in place and makes it easy to put on and take off. It is FSA and HSA eligible, comes with a 30-day money-back guarantee and a 1-year warranty. Go to ematerm.com, that's EMETERM.com, and use code HAPPYBIRTHWAY for 20% off of your purchase. You can find the link in the episode show notes. So this is a really cute question I got. What if someone can't go into labor on their own? So let me tell you something. Everyone will eventually go into labor on their own. The question is when are they going to go into labor on their own? So if they don't do it by a certain point in pregnancy, somewhere between 41 and 42 weeks, the risk of stillbirth increases enough to warrant that inducing labor with Pitocin would be more beneficial than not. And again, it's always a conversation that you have with your provider. But, before these studies came out about the increased risk of stillbirth, women would be pregnant until 43 or 44 weeks. And a lot of times it's hereditary. So if your mother was pregnant until, 43 weeks, then not 100%, but it's highly likely that you're probably going to gestate for longer rather than, less time. So, most people will eventually go into labor. I don't know if there's such a thing as like holding the baby inside forever, but it comes to a point where the benefits of having an induction outweigh the risks of keeping the baby inside for longer. Now, I got several of these messages and it makes me livid. It makes me so angry. Someone wrote why with 1,000 Y's at the end of her WHY word. Why did the nurse give it to me without asking or telling me when my labor was actually progressing? Patients should be informed and given the opportunity to consent before they receive any medication or procedure unless it is a dire emergency. So every single one of you who are listening, this is completely inappropriate, is patient rights violation. And sadly, I'm sad to hear that this is still happening. Please tell your provider and that anyone that's part of your birth team that they need to obtain your consent before administering any medications. You deserve to know. It is your patient right. And then, of course, I got another message and another message and another message saying basically the same thing. But I took one of the other messages that said, this person wrote, I feel like once you have the epidural, they just give you Pitocin without asking. I didn't even know if I had it. You know, it almost feels like maybe some of these providers are trying to hide something. You know, is it because they know that the patient may potentially decline the Pitocin and they know that it makes their job less convenient if that happens in their eyes, that it might prolong labor? So are they trying to hide something? I don't know, but I've gotten too many of these messages to make me really, really, really upset and to know that this is a reality that is unacceptable. The next question that I got is it important if the water has already broken and there are no contractions? So this is a kind of place where it can go several ways, and it's, again, very dependent on individual circumstances, whether you have group B strep or not. The concern with the water broken is that there's increased risk for infection once your amniotic sac is ruptured. You know, until your amniotic sac is ruptured, your baby's in a sterile environment. It's not exposed to any microorganisms, good or bad, you know, the good bacteria or the bad bacteria. So once your water is broken, your baby is, you know, exposed to everything in the environment. But that being said, some people can get an infection a few hours after their water breaks, and other people will go 72 plus hours with no infection. So it's impossible to tell. But what I can tell you is that your risk for developing an infection during labor is increased once your water is broken. So again, there are several different factors. And obviously, if you already have a fever, then that is really, you know, an important thing to expedite the delivery. In most cases, it can be reasonable to wait some time for labor to start on its own if that's what you desire, but make that decision together with your provider. However, I will add that minimizing vaginal exams is extremely important if your water is broken. So if your water is broken with no contractions, there are really very few reasons why an exam would actually be necessary. It wouldn't change the trajectory of your care plan, because if you decided that you wanted Pitocin and you had no contractions, it doesn't matter how dilated you are. You have no contractions, your water is broken, and it is completely medically reasonable to, you know, to augment your labor to actually give you the contractions for you to go into labor. So whether you're 1 centimeter or 3 centimeters doesn't really matter. And, you know, this is especially important if you're group B strep positive. If you're group B strep positive, I really hope that you have a provider that practices this way, but unfortunately not all of them do. Do everything within your power to delay a vaginal exam, until at least 4 hours have passed from your first dose of IV antibiotics, usually penicillin. Okay, so there's really very little reason for providers to be putting your hands up there if your water is broken and, you know, you're trying to determine whether you're going to use Pitocin, etc. And, you know, I got a lot of questions of when is it really necessary, when is it not necessary. At the end of the day, I can't tell you that, because every single person's situation is going to be so individual. But let's go back to our BRAIN acronym, which is a great acronym for you to be reminded on how to make decisions about your care. So B stands for the benefits. What are the benefits of an intervention or medication or procedure that's being recommended? R, what are the risks? A, are there any alternatives? I, use your intuition. You know, everyone is an expert on their own thing, but you are the only expert in your life. So use your intuition about what it's telling you, because you can decide best for yourself after you have that information. And N is, you know, nothing or delaying. What will happen? What can happen if I delay a treatment? So use that BRAIN acronym when you're discussing this, and hopefully your provider will respect you and will inform you that Pitocin is being hung before it's actually hung. Someone wrote, I wasn't asked, I was told, but ended up not needing it last minute. And really, remember, sometimes your provider's tone and communication style may come off as telling you what you need to do rather than actually advising you of their recommendation, because it's their job. Their job is to advise you of, their recommendation, of their expert recommendation, but not to tell you what to do like you're 3 years old. So remember, regardless, the decision is yours to make. No one can force you. Unless it's an emergency, you have the right to ask whatever questions you need and understand. You can go back to episode 55 about shared decision making. I discussed that in depth, and that is really the model of care. That is the best model of care to be used with patients. And the crazy thing is that multiple people messaged me saying, does this kind of consent really happen on a regular basis in your hospital? This is, I'm verbatim reading one of the messages I got, one of many. I mean, I know it's supposed to, and I'm sure you do it, but is it really truly what is done by the majority of nurse providers where you work? Absolutely, 1000% yes. And I'm sorry that it's not done everywhere. And I've worked in more than one place. And this is what should be done. This is what is supposed to be done. This is your bodily autonomy over your body and making decisions as to what happens to you. And so it just intrigued me because, I was getting more messages like this. I put up a poll asking, were you included in your care decisions? And only 47% of women answered yes. Only 47%. I cannot believe it. 28% said no, and 25% said 50-50. It was just really, really, really sad for me to know that it's happening so infrequently. And then we got into this whole conversation, and I got so many messages, heartwarming messages from people like this one, who wrote, hard to believe that this happens. My doctor and nurses were great and asked before doing anything, both in office and in the hospital. And there are so many amazing providers, so I don't want to discourage you, but I do want to give you the awareness and to understand the red flags where if you're having second thoughts about a provider that you're using and something in your gut is telling you that something is wrong, these are great red flags for you to figure out. If your provider is not taking the time to explain things to you, then you may want to reconsider using that provider. So someone else asked me a question, is Pitocin a safe choice if using to help labor progress in order to avoid a C-section? Interestingly enough, a lot of times the intention for Pitocin use is actually to avoid a potential C-section, such as in the case of, an infection with your water being broken. This is a prime example of actually using the Pitocin, because if you don't go into labor, the infection can progress and be very dangerous for your baby. So that's a reason. Baby can come out in one of two ways. So the preferred way is vaginally. And yes, if a baby needs to get out sooner than later and a vaginal birth is not contraindicated, then an induction is an attempt to actually avoid a C-section. And there are actually certain placenta-related conditions where research shows that at a certain point, the mother is more likely to have a C-section if she waited longer because her baby won't be able to tolerate labor. One prime example is intrauterine growth restriction. So if a placenta is truly not functioning optimally in utero and a baby is not receiving all of their nutrients and the growth is stunted, then a placenta needs a lot of reserve. The placenta typically saves a lot of its extra reserve, like a cushion, for labor because labor is so stressful. And it needs to have that extra bit of reserve to continue to oxygenate your baby under a stressful situation where your baby is being squeezed, where everything's being squeezed and there's a little bit less time to get the oxygen back into the blood vessels. And so if the placenta is not really robust and is not able to develop that extra reserve, then a baby may have a much harder time tolerating labor. And so if we induce a patient earlier on where their placenta is still kind of okay, but really reaching to a point where it's getting weaker and weaker, so to speak, then we may actually avoid the need for a cesarean. So in certain cases like intrauterine growth restriction, it is actually used to avoid a C-section because a baby hopefully will tolerate labor with a placenta that's not so bad yet, and that may get, weaker and weaker over time.
Having a fussy, nonstop crying baby can take all the joy out of motherhood. Is it gas? Is it constipation? Is it colic? It's hard to know, but there is a solution for all of those. Happy Tummy is a waistband that comes with an herbal pouch. When you microwave the pouch and apply the waistband to your fussy baby, your baby is instantly soothed. That's thanks to natural formulation of herbs including flaxseed, chamomile, lemongrass, peppermint, spearmint, and lavender. Happy Tummy is all natural, no drugs or drops. And not only does it quickly soothe your baby, but it smells terrific. Happy Tummy also has adult-sized waistbands, which mothers love for cramps, stomach aches, and back aches. Use my code HAPPYBIRTHWAY for 10% off your whole order on happytummy.com. That's HAPPYTUMMI.com, code HAPPYBIRTHWAY for 10% off. Kiwico crates are a monthly subscription of crates that come filled with age-appropriate STEAM projects for kids, from toddlers to teenagers and even adults. STEAM stands for science, technology, engineering, art, and math. Every crate explores a different theme designed to spark creativity, thinking, and learning. All projects, inspiration, and activities are created by a team of product designers in-house and rigorously tested by kids. Kiwico offers all different product lines spanning a variety of interests and age ranges. Panda Crate is for babies from 0 to 24 months. Each crate helps babies learn by doing what they do best: playing, exploring, and most importantly, interacting with the people in their lives. Crates arrive every other month and are filled with 2 months worth of content. So if you're trying to figure out what a developmentally appropriate way to interact with your baby is, Panda Crates will take the guesswork out. For an exclusive 30% off discount on your first month subscription, go to kiwico.com, that's KIWICO.com, and enter code LEARN30 at checkout. That's kiwico.com, code LEARN30 at checkout. Thanks for tuning into the Happy Birthway podcast. Head over to Yoledet Academy on Instagram to continue the conversation. You'll find the link in the episode show notes, as well as links to any additional resources, products, and services mentioned here. If you love listening to this show, you can help it grow by sharing it with your friends and rating and reviewing it. To stay in the loop when new episodes are released, make sure to subscribe. Remember that your health needs are unique and require individualized medical advice. The podcast is not a replacement, and some of the information may not be appropriate for your specific circumstances. My mission is to educate you so that you can confidently collaborate with your healthcare team. I believe that a healthy mom and healthy baby are simply not enough. We also need a happy mom with an empowering birth experience.